Today we have Dr. Ruth Roberts. I am so thrilled to hear from her because I know most of you know that the reason why I created this membership is because of the scandalous nature of these holistic pet schools out there. And so I invested in Clayton College of Natural Medicine, and they literally closed down while they were taking people's money the day before and claimed bankruptcy, grabbed the money and ran. I went to another naturopathic school and tried to sue them and they gave me my money back, and then ended up at Kingdom College. And that college, I got my animal homeopathic certification, but there was no mentorship and no real pet professionals in it. So when I started seeing Dr. Ruth's ads popping up on my feed all the time, I was like, this is so smart. I'm so happy, Dr. Ruth, that you took this and you're running with it as a legitimate veterinarian with real information and mentorship. Thank you for being on here today, and your beautiful dog.
Hi, yo. So it's my mom's joke. You're old enough to remember the Lone Ranger too. So she's a silver poodle. So her name is Hi Yo Silver.
Hi, ho.
Away.
That's awesome. Right on.
And thank you, Poppy. I mean, those are very kind words, but you're exactly right. This program, the Holistic Pet Health Coach Certification Program, was born out of huge amount of frustration. I had a consulting client that had a dog that did have a list of problems. She was working with me, she was working with an internist. She walked into the internist for their monthly visit. The creatinine had increased by 0.1 point, and the internist looked at her and said, Janice, I'm afraid that, this is really the end of things for Rosie. And Janice is like, well, what are you talking about? The lab went up a smidge, but she's the same as she was a month ago. And so the internist said, well, I'm sorry, I'm afraid really the next treatment for Rosie would be euthanasia, and there's nothing more I can do for you. Slam, after 3 years of working with this woman. And this is during COVID. I know that things were brutal for my colleagues trying to deal with all of the patients they were seeing. But it's like, expletives, expletives, expletives. What the heck is going on here? Why is this client, who has been compliant and upfront and direct with this internist and gotten her dog through all of these things, the whole alphabet soup, SARS, IBS, CKD, blah, 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 and the dog is maintaining a good quality of life, why is the internist shutting her out? And so she thankfully had me to turn to. And then we worked together and found another internist that was willing to help her help Rosie. But this got me thinking, what if you don't have the wherewithal? What if you don't have the $10,000 that they want you to spend on MRIs and this test and that test, and then you still don't know what the heck to do? And I'm looking at the human coaching and realizing, literally in the 80s, this went from the doctor coming in saying, oh, golly, it looks like you're pre-diabetic or you're diabetic, and Betty, my nurse, is going to come in and talk to you and tell you what to do next. And I get it. And that was kind of the facilitation on the human side to actually provide patient education. And then as that field developed, the health coaches turned to more and more holistic measures to incorporate into their clients' packages, because what was available on the conventional side was not much. I mean, it finally took the American Diabetic Association until 2013 to say, well, maybe you really shouldn't eat so much sugar. Maybe you should eat whole foods more. So it's just like that ludicrousness has unfortunately gotten really big in veterinary medicine. So that's where we
Well,
are.
I am so thrilled that you picked up this torch for the animal kingdom, because the stats are dismal. And like you said, COVID, I actually made more money during COVID than I had in my my door-to-door practice. So I'm quote, an animal naturopath certified, but it's more like a wellness coach. It's a
Right on.
glorified name for a wellness coach. for animals, and I would drive to people's homes and work on their horses and dogs. When COVID hit, I converted to online. I actually made more money because people were at the ER for 8 hours, backed out the door, calling me going, I am in my car. I've been at the vet for 8 hours. Can you just help me? And I'm like, yeah, let's talk about this. Maybe I can and maybe I can't, but
Yeah, I mean,
we'll
it's
go
just
there.
it's and exactly. And so more power to you. I think that anybody that was doing this remotely during that period of time was just overwhelmed with business. And there still wasn't enough of us, right? I mean, you were probably got to the point where you're like, I am so sorry, but I actually need to, go buy groceries and things. Um, but it's just insane. And there are so many of my colleagues that are doing consulting, so many people like you, Poppy, that have either a combination of education and personal experience about knowing what works, but there's just not enough of us. And we were chatting earlier about the Mars study about what is going on with the shortage of veterinarians. And I came across this because there was an article in the American Animal Hospital Association journal entitled "If You Think It's Bad Now, dot dot dot." And so they went on to, hit the high points of the study, but the upshot is this: in 2030, we will be 24,000 veterinarians short. I mean,
That's so amazing. Like that, I I understand pets are prolific. Like there are more and more pets in the world, and we love our pets, right? They are now the new children. And vets, I know girlfriends, I'm friends with lots of veterinarians that are in their 40s still paying off their vet school.
yeah,
It's just
it's
dismal.
it is dismal. And it's the truth is they're all of the schools combined are graduating about 2,500 veterinarians a year. And you combine that with a certain territorialism in my profession, and the fact that pet ownership has exploded, and that, you know, at the advent of COVID, people my age and older, I'm 60, were like, heck with this, and retired. And the vet techs, with all of the talent, all of the skills, said, heck with this, I can work at McDonald's and make more money, and people aren't screaming and shouting at me. I mean, we had a serious brain drain of the profession, and we're not keeping up. I mean, I think what happened is that 15% of us that would have stayed working for another 10, 15 years that would have helped sort of offset this huge problem just were like, I'm done. And some of us are coming back in because ultimately we're bored and we still want to help pets, and doing this in more of a sort of a one-to-one consultation through Zoom links. But the other component is that the FDA and the AVMA relaxed consult video telehealth laws basically during COVID. The FDA never pulled it back, but the AVMA is trying to claw it back really badly. And but it's ridiculous, right? Because how much faster could you, the pet parent, be served by your veterinarian when all you need to do is talk to them about how's the skin lesion looking? And you take your cell phone and you show them, and they can say, okay, super, looking great. Or, oh my God, that looks horrific. Please come back in and let's do this, that, and the other. And then the staff knows to do this, that, and the other, and the doctor doesn't have to really even be there. But that's kind of the problem, is that we haven't really pivoted into using our support staff for what they know how to do. And that's
Is it is it illegal for veterinarians to do like televet services?
so the deal is, according to the AVMA, is the veterinarian client patient relationship. The VCPR has to be in existence. So what that means is that if I've never seen your dog, I should not comment on what you're showing me. Even though I can look at, there are some things you just look at them and you're like, oh my God, yes, that's that. And you need to go to a vet right now. Or just try this over the counter. That exists on the human side, and sadly, they're for urinary tract infections, for example, for people. You tell them you have the symptoms, they write you the prescription of antibiotics, which believe me is not the right solution either. But
Yeah.
they don't have to physically see you in the office, and there are many conditions that this is absolutely suitable for. But because of the um, territorialism, I guess is there's another word I can't get to today, of the profession, we're unwilling to let that happen, which would facilitate care. Because the other thing is that a veterinary technician could assist with this and triage patients. And then that 8 hour backup or 4 hour backup it's finally down to in the ER maybe isn't so horrible because the patients have been triaged before they even left their homes. So
Right.
it's
And
just,
I always, part of my coaching is how to talk to your vet and how to set yourself for success in the vet office. Like, call
yes.
ahead. If you have to go to the ER, call and see what the waiting list is and see if they have another vet referral if it is too long. Like, gauge it, let them know in advance the level of emergency and how, get all your notes and files in order and be ready and take your vitals and just have everything good to go. That's going to be like getting you in the door and a happier experience faster. So, yeah.
Amen to that. And the other thing too, I mean, this is part of what I teach the coaches is get the list of questions pulled together. So that because you're going in there, the vet's like trying to run away immediately once they've entered the room because and I'm not trying to throw my colleagues under the bus. They are just that crushed with business. If you have everything pulled together, here's the history, here's the previous labs, here's what he's taking, and here are the questions I need answered today. Then you can make that appointment extremely efficient. Your pet gets what it needs. The veterinarian is like, oh, thank God I don't have to, figure this out as I go along and look for this and look for that. And you get your questions answered so you know what to do next. And I think that is absolutely critical, is getting as much use out of that 75 to $150 visit as you possibly can.
It's a win-win for everyone.
Yeah,
Yeah,
exactly.
the vets are crunched. It's the number one suicide career right now. I've lost a vet girlfriend, and you have to be kind to them. You guys, they're under so much stress and pressure, but being able to help coach the small stuff is such a gift to everyone. I don't think all the vets feel awesome about it, but the holistic vets, I think, are pretty much on board. I have a lot of holistic vet friends. They're totally fine with what I do, and they know that I will refer them.
Yeah, exactly. And that's the other key thing is that each of us needs to understand what our limitations are. And coaches are meant to do exactly that. Yes, there are some options you can help support pet parents with, like PIM for red light therapy, or all of these other amazing modalities. And the other big thing is providing support with nutrition, how to use those supplements appropriately. And I mean, that's what I don't. I would imagine you've experienced this, Poppy. My coaches are like, "Oh my God, this dog is on 27 supplements. No kidding." And it's like, with that, how can you know what's what, and what's providing benefit, what's not providing benefit, and maybe what's creating a problem?
Right.
So that's the whole thing, is having that confidant that will help you figure out what's going on, what can we adjust with what we've got currently, and what do we need to add in.
Yeah, I call it the kitchen sink cocktail. And so, yes, I think it can be sketchy. And the horses, I believe I do a lot of barrel horses, and I believe they thin the blood so much with all their supplements that is part of the reason why these race horses are bleeding, is just too many blood thinners.
Right
So
on.
people don't understand that.
Yeah, and that's it. I mean, supplements are exactly that. They're supposed to supplement the diet. And it's kind of a double-edged sword. The Deshay Act allowed us easier access to supplements, but it also contributed to an explosion of supplement manufacturers and promoters that sometimes are ethical and sometimes are not.
Oh, yeah. So the dishonesty in the manufacturing too, like the snake oil salesman. Janice and I were just talking about this is, holistic gets a bad name often because of the get fixed quick mindset of we have a product, it's a cure-all. And anytime it sounds too good, it probably is too good,
Yes. Yes, right on. Right on. So, and that's it. I mean, just exercising logic when you're starting to think about things is really what you need to do. I, we were talking about a supplement, joint supplement today, and the ingredient list was pictures of some of the supplements included, but no idea how much of any of them, what other inert substances may be in there. And then, you, the consumer, many people just go based on the testimonials, but that's not really a good way to choose a supplement and to know whether it's going to be efficacious or not.
That's so wise. Yes, I see it all the time is it reads well, but doesn't feed well because there is some inert ingredients that they don't divulge and maybe shoddy resources. So
Or simply, it's got all the things that we know are good, but they're not at doses that would actually be helpful.
when they have
That's
like 25 products all in one,
Yeah,
I always look at that and go, well, there's like 30 ingredients listed on here and you're giving a half a teaspoon. How much are they actually getting of these 30 ingredients? Like it's inconceivable.
right on. Right on. It's just horrifying. And yeah, the
So
that's exactly it.
Janice
And
is saying the few things she runs into are that the drugs are focused and nothing is offered beyond the explanation, missing practicality. Yes, Janice.
yes, that's
Yeah,
exactly it. And so the actual conversation between the doctor and the client doesn't happen beyond take this and come back in 3 weeks. And that's the other massive thing is that where do you get the information? Now you've been told by your vet that your dog's creatinine is 2.1 and it's in kidney failure. Feed this bag of food. We can't really do anything until it gets worse. Well, it's not in kidney failure for starters. It does have kidney disease, and the bag of food is maybe going to make things worse. And so then what do? You go home and you read and you buy the 6 kits for kidney failure online and use them all. And that's where, I mean, it just is maddening that that's what's happening. So more, we need more people like you, Poppy, that are able to go explain, okay, here's what this means when the creatinine is 2.1. Here's some really basic things we can do to improve kidney function. Let's do that. And then go back to your vet and retest the values in 3 to 4 weeks and see where we are.
Yeah, and I see such a division between allopathic and holistic where we end up vilifying each other. And I wish it wasn't like that. I wish it was more relational. You're on this medication. You cannot mix Sam E with it. You're on this. You cannot mix St. John's wort with it. Like
Right on.
there's issues that we have to be aware of. It's a big topic and there's a lot of information, but people don't know this without people like you, Dr. Ruth, because
Yeah,
who's going to get this information? It's not common knowledge.
right on. And that's part of the reason for the coaches. And then, back to my colleagues that are just fried, I think that's part of why we're seeing such a huge pushback from the allopathic or conventional community because they are already so stressed out. And then anything that is remotely challenging is like, "Ah, I just can't even do it." And so without thinking, they snap and lash out. And if they had more time and were not so stressed, I don't think that would be the case. But a lot of pet parents are experiencing that right now, to the point where they just don't even tell the vet what they're feeding. And they say, yep, I'm feeding that bag of ID. Yep.
Yeah, that's true. Because they're going to
Yeah,
get shamed.
exactly.
A
And
lot of my
that's not
clients have
helpful.
been shamed to the core of their being, and they're terrified to have an honest combo with their vet.
Right. And then the veterinarian truly is operating blind. But this is, it's a self-caused issue, sadly. So,
Right.
yeah.
Oh my goodness. So what do you teach in your courses? I'm so excited to learn more.
So the cool thing is that the way I broke this down was to because the goal is to have these people out running a business, helping pets. How to run a business, how to do the technology part, how to understand who their client might be, and how to speak to them about that.
That's
And
amazing. I never got that.
and it's so useful, right? And we do that in the first two modules, and I think people get in there and they're like, "What? I want to learn the good stuff." But if you just get that part out of the way and let that marinate while you're learning the rest, then who your client is, how to speak to them becomes more clear over the following months. But the first thing I do is teach them the concepts in functional medicine, which is something that a lot of us are doing, but most of our clients don't understand what that is. And that's looking at systems of function rather than organ systems. And so the big ones are modulating inflammation, improving detoxification, and improving digestion and assimilation of nutrients. And then I also introduce traditional Chinese veterinary medicine and some of the concepts there, because I think it's an incredibly powerful tool, even on a relatively superficial level, to have a different way to look at what's going on with this dog. Because sometimes things don't make sense when you're coming at it from a physiologic perspective. And then you add that layer of traditional Chinese medicine on top, and you have a different way of understanding relationships between aspects of the body. And then the next part we jump into is food. I am a proponent of home cooking because traditional Chinese medicine is the way that I was trained. And so I developed the original CrockPet diet actually at the first pet food recall back in 2006 and 7. I'd already started using it for my own pets for my clients. And in 2007, all of a sudden we had 1,000 dogs eating cooked food. And it was like, holy smokes, I cannot go back to the bag of food. I'm saying that that's okay. So we go through that. We go through GI and digestion, how to use food sensitivity tests to develop something called rotation and elimination diet so that we get the immune system to stop reacting to what the dog is eating or the cat. And from there, then we start to go through the different organ systems, and then how to support them both with food, functional medicine, traditional Chinese medicine, and different supplements and different options to use. And then we'll have one more business model in there to kind of help you bring that back together so that by the time you graduate, you know how to start talking to clients about what your offerings are, what they're going to cost, and you know that you're not going to shortchange yourself financially. And that's because we all want to help animals, right? But we have to be able to take care of ourselves too.
Right.
And then we finish up with autoimmune disease and cancer. So it's huge amount of material. Um, it is approved for 40 continuing hours of education credit for veterinarians and veterinary technicians. So that gives you an idea at the level of which it's taught. It's
That's
not definitely,
amazing. Do
I was
veterinarians take
astonished.
your do veterinarians take your program?
I've had vet techs take it, and the veterinarians are crickets. But I think again, it's because they are just so overwhelmed, and that's kind of my next goal is to develop 3 lectures to teach veterinarians how to trust your staff, how to delegate some of these things, and let the staff do the education so that you do what's important. You look at the dog, you look at the cat, you look at the horse, you develop the diagnosis, the treatment plan, and whatever prescriptions, whether they be holistic or conventional that are appropriate. And then you have this person in your office that can get on the phone or get on a Zoom call with a client and say, okay, well, doc says that Fido has inflammatory bowel syndrome. And what that means is this, and gives the explanation. And so you're not just stuck on the internet figuring out what IBS is. And here are some other things. And he or she mentioned this and this and this. And here are some other things that may be helpful. This is a perfect time to do a food sensitivity test. We can develop a rotation and elimination diet, which will help the gut calm down, and then hang with you for the next 6 weeks or 2 months that takes to really get it all sort of in the right pile. Because not as you know, not every pet responds the same way to one particular thing or the other. And so figuring out what's working, what's not working, and pivoting when it's not working, and helping the pet parent understand when it's time to pivot and make those adjustments. So
Like
that's,
a dance. It's like a dance. And it's so nice because so many pet owners need their hands held. And
they do.
the vet cannot be holding your hand anymore. There
Mhm.
was a time when those old school vets would be able to like pick up the phone, talk to you, show up, come over to the
Right
range.
on.
But those days are over.
Sadly, yeah. And it's really frustrating. I mean, when I left my last brick and mortar practice, my appointments were an hour to an hour and a half, the initial appointments, because it just took that long to figure out what happened way back when they were a puppy or when they were a kitty, and what are the things that happened along the way that made this get worse or that gets worse. But and that's the other beautiful thing. This is what coaches have the time to do, is to really go through the history, go through that intake form, and ask questions. Well, when did this start? And was there something that happened just before this that made it get worse? And sometimes they can find that missing link, that if we can go back and address that, it makes all the difference.
You know, I'm so excited about this. How many people have gone through your course? How many people are certified? What is the results of all this?
We have 50 people that have completed the certification program. We have another 60 that are enrolled currently. We're enrolling about 10 to 15 students every month. And they are, and the other thing is too, is just really increasing awareness that this option is available and it's happening on a large scale. What the results have been is that I mean, every coach has the success story of getting the dog off of Apoquel, every one of them.
Everyone.
And everyone, because the concepts are really simple if you know what they are. And that is, fix the leaky gut, calm the inflammation down, calm the immune system down, and then the skin calms down.
Well, and
So
people don't realize that autoimmune is an overactive immune system. So they just keep shoving immune builders at it, creating a cytokine storm.
exactly. And and there's different flavors of it, but that's exactly it. There is a price to be paid when you use something that messes with the immune system. At some point, unfortunately, cancer is associated with many of these drugs. And that's why on the human side, if you have cancer and have chemotherapy, there is some percentage chance that you may develop another cancer or an autoimmune disease because your immune system has been manipulated. And so that's critical to know too. Then you're going to pay really close attention to modulating your immune system after that. But if you don't know that, you're just going to go on hunky dory back to eating pizza and thinking it's all good, and it's not. So that's it's just so critical. We just don't understand sometimes the actions that we take, what the impact will be down the road. And that's really difficult to see that, if we're spaying and neutering at 8 weeks of age, what are the impacts down the road? And unfortunately, I mean, my belief is that that's actually the biggest thing that we are facing with our dogs and cats right now, in terms of chronic disease, is that they have never been endocrine competent, and their luteinizing hormone levels are astronomically high. And then we have tissues developing receptors for luteinizing hormone that just shouldn't even have them. And everywhere there's chronic disease that occurs commonly, there is documented research showing that there is an astronomically increased number of LH receptors in those tissues. So it's just putting all the pieces together is hard. And if you don't have that resource to help you do that, it's just almost impossible to see your way clear to what really good next steps are.
Hormones are healthy. Let's be
Amen.
real. Like natural
We need
hormones
them.
are healthy. Synthetic
Yeah.
hormones are not
I
healthy.
mean, they're better than nothing, but still, I mean, it's crystal clear. So for women, I mean, if you take both ovaries out of a menopausal woman under the age of 64, you have just shortened her life by 4 years. What are we doing when we take the hormones away from an 8-week puppy?
Yeah, he's actually a product of that too. So I'm always looking for testosterone builders. I keep looking for Rocky Mountain oysters for him,
There
but
you go.
I haven't found them, but I need to reach out to my rancher friends and be like, hey, send them my
Hey,
way.
hook me up. Well, and that's it. I mean, so while this is a synthetic solution, it still helps. And so there's a guy named David Bieber doing something called dogsterone. And what he's doing is teaching veterinarians how to use testosterone injections appropriately in the way that the FDA says that we can, which is for arthritis or the frailty of aging. But it's been a game changer for a lot of dogs. So,
Yeah,
it's just, yeah.
because you're TCM oriented, I always am excited about antler velvet and then I forget to order it.
Yeah, and I mean, I think you need to that's been a supplement I've had a hard time with because some parts of that industry is pretty awful. The cruelty to and then there are people that are really good quality producers. So I think you just have to do your research and find that out. But it's a Jing tonic. And so if we tonify the Jing or the essence, then everything is good, right? So Jing is the amount of time that you have in life, the candle you can burn. You can add to the Jing by feeding really well, having an excess of gu qi or food qi, and then that gets transferred into postnatal Jing. You can
Interesting. I
supplement
don't
to add
know.
that too.
Yeah, I'm not versed in TCM other than like warming and cooling. And so just very, very simple energetic stuff. And that's my knowledge. It's just totally foreign to me.
It is. I mean, it's the thing that makes the coaches just oh, because it is very confusing because many of the names are still the same. They're still the kidney, they're still the spleen, they're still the liver, but they're with a capital K, a capital S, and a capital L. And some of the functions are similar, but some are not. And it's a brain buster for sure.
Yeah, I was at the vet clinic yesterday. My dog was a demo dog for an ozone therapy clinic, and
Right
they were
on.
talking about a dog with a sore back. And I go, what about the kidneys? And they looked at me funny. I go, well, kidney and back kind of go, kidney pain and back pain often go hand in hand. And it was an older dog. And they're like, well, it's right on the kidney point. So yeah, it could be.
Right on. And
Yeah.
that's it. Yeah. Because
Yeah.
that's the
In,
bones and joints and rear end go with the kidney, along with the
yeah.
ears and hearing.
In horses, I see a lot of I mean, I get called out for sore-backed horses, and often it's as simple as a kidney cleanse, but nobody in the horse industry talks about kidney cleanses. It's not like a
Really
common
interesting.
combo. It's very primal compared to what we're doing in dogs and cats. Yes, it's
Wow.
a huge market that could be tapped into for sure.
Wow. Cool.
Yeah. Yeah,
And
and
that's it, because I think on the equine side in general, there's not very many people like you trying to incorporate sort of an umbrella of holistic options. I know there's the chiropractors, the acupuncturists, but
whole health.
and I think they'll bring herbs in, but that's kind of it.
Yeah, I do homeopathy and herbs, iridology, which is just a blast. And this whole group does all of that. We talk about all things animal holistic. So I just interview people on the gamut of all your options. And so, and we haven't run out yet. This has been like
There's
the
always
fourth
something
year
else,
and we
isn't
just
there?
keep going. I'm like, hey, we can keep going.
Right on.
So we
Cool.
did hair tissue samples with Dr. Katie. We did color therapy with Pam Russell. And so my whole goal is to provide a broad range application of anything and everything in the holistic space, frequency healing, blood reading, whatever. And it's just been kind of a fun free for all to learn anything and everything in the holistic space to add to your practice or throw it out.
Right on. And that's the thing too, is that what and that's kind of the beauty of TCM, right? Because you can have a diagnosis of, say, kidney yin deficiency, and that could show up as kidney disease, or it could show up as urine leaking. So it just depends, but that's the beauty of all of these different modalities. It's lots of different ways to approach the same problem. And if one doesn't work, maybe the next one will. So I think that's the other thing is the individuality. If the animal can't absorb things very well through the GI tract, that's where supplements and herbs are going to have a hard time doing a good job versus some sort of an external treatment like hemp, red light, sauna, something like this, then you may see some benefits, and then the animal gets well enough to add in other modalities.
Yeah, the ozone hyperbaric.
Yeah, I mean,
Those-
there's so many options
There
that don't
is.
require the gut to work anymore, which is crazy good.
It's amazing. It's a fun, holistic world out there if you have it available to you and if you even know what's available. So just create
Yes,
awareness.
and that is the absolute beauty of the internet and all of these groups is that you can become aware of what is available to you in short order versus 15 years ago trying to figure this stuff out. It was like literally like pulling teeth trying to find that next option for your dog.
It's true.
Yeah.
Like a pet homeopath was not a common Google search.
Well, I
Yeah.
mean, so 20 years ago, there wasn't even Google. There was Alta Vista, right? And that's it. So Charlie Loops has been out there forever and ever, and PJ Broadfoot. But unless you were there or somebody you knew had been there, you didn't know that they existed.
Exactly.
Oh,
Exactly.
sorry.
Yeah,
Yeah.
I hope to get PJ on here too. Um,
Amen.
yeah.
She is an
All you
amazing,
pioneer women.
and she's the one, man. She is. I got to spend some time with her when we were out in San Diego, and she just is. I knew she was smart, but I know she was that smart. She is just amazing.
Yeah, I really want to talk about the thymus gland. It's
Thimerosal, yeah, totally makes sense.
yeah, for all the metabolic disorders. It's just
Yeah,
so in humans and horses and dogs and cats, it's all on a rise.
yeah, it is, and that's if you can modulate the immune system appropriately and get the body to respond appropriately to different things that are coming in, that's a game changer.
So if people want to become a pet health coach, how did they do it?
It's super easy. You go to drruthroberts.com. There's a page there. You can go to holisticpethealthcoach.com. You can sing out on the web page. You can sing out on Facebook. We have an active group called Holistic Pet Health with an astonishing 30,000 members. The coaches are in there actively helping pet parents. They can tell you more information about their experience. So it's just start plugging in a couple of those things and jump in.
Yeah, Hannah invited me to that group and I was shocked how many people were in there. I was blown away. I was like, are there
It's
no pet health coaches? What is this? What's happening here?
These are people desperate for help. And I mean, some of the stories are just heartbreaking. And I know you're hearing some of the same things, but it's just insane. I mean, these are people that have spent that five, six, $10,000, still don't have any answers, still have no improvement, and they know there's something else out, but they just don't know where to go next.
Yeah. Thank you for this. And thank you for your time Do you guys have any questions? Anybody that is here on Zoom or on Facebook? Is this something you're even interested in, is creating a career as a pet health coach? And how awesome are your pet health coaches doing?
They're really starting to pick up. So it's been a struggle because it's something completely new. But I would say that on average, they're all seeing somewhere on the order of 3 to 5 clients at minimum per week and growing. And I think this Facebook group has helped tremendously with that. And the other thing is that, so they're making at least a couple of $1,000s a month and beginning to recoup their investment, get
Right.
some experience that they can share with the world. Look, I was able to help Susie Jones with Muffin, and Muffin was here, and now Muffin is here. So they're doing great there. But my goal is to get these folks making at least $5,000 a month so that they can sustain themselves.
Uh,
Part of the deal is too, we have a lot of partners in the holistic industry that will offer affiliate accounts, wholesale accounts, that obviously affiliate and wholesale accounts on my supplements and what's available on my site. And then also FullScript, which is the largest dispensing platform on the human side for supplements, has recognized holistic pet health coaches as legit providers. So they now have their own accounts with FullScript, which I'm just so thrilled about. So
That's
it's coming.
cool. Wow,
Yeah,
that's
yeah,
really neat.
yeah. Because well, if you've got experience with FullScript, you know kind of they're like, no, you don't have this degree. So basically, they complete and boom, upload their certificate. And Janet's asking, how does this differ from being a certified nutritionist? And nutrition is a component, and it's the key component. If you're, I always say you can't outpill a bad diet. So we go through those basic concepts. But on top of that is then how do you use TCM? How do you use functional medicine to support the most common conditions that we're going to see with our dogs and cats? And thanks for asking, Janice. You've got all the right questions, or Janet, sorry. So the other part is that we offer mentors, and they will start as a one-to-one mentor for a couple of calls. Because we're getting so many students, we're going to group office hours. So there are 2 hours every week where you can jump on a call with your mentor, ask questions about what's going on with one of your own pets, with a pet you may be working with, or if you're like, what in the heck does she mean about this when she says X, Y, and Z? That's available. I do weekly coaching calls that are available to all the students. And we also have an ongoing program for the graduates called the International Holistic Pet Health Coaching Association, which I'd love to get everybody into that umbrella, whether they've come through that program or not, so we can share our knowledge and support each other. But
Can I
that's,
get
please,
certified with that?
you can join the association, and then we can start looking at, because you've got credentials, right? And so my
Well,
goal is,
it's called an animal naturopathic certification, but I'm like, how legit is that? Like somebody just wrote that out, you know?
well, I mean, to be fair, I did too, right? I created this out of a need and an abundant need for this service. And everything starts like this. It's somebody's idea that takes off, and then it's a thing.
What
So
it needs, I've always felt like the holistic industry is the wild, wild west. If you're not in the holistic veterinarian field, it's been unregulated, and there are charlatans out there that love to just fill you with a bunch of bull and suck you in and sell you a ton of stuff. And then there's legitimate people. And how do you weed that out? You need an organization, you need an alliance.
exactly. And a code of conduct and a code of ethics. And the ability for members to say, hey, this, when you did this is kind of a little not so good. And then that person is either willing to say, yeah, you're right, or I'm good with that, and roll on. And then the group can say, that's not what we're about. We're here to help people. We're not here to rip them off. And there is a lot of that, sadly. So that's kind of my goal, is to pull as many sort of bits and pieces together under one umbrella, partly so we can share our knowledge, but also to legitimize ourselves. Because if we've got a, like, here's what we believe how it should happen, and here's how we agree it will happen, how we'll protect our clients and our clients' pets. It's got to happen, because there's a lot of stuff out there. And the other thing is liability, because America is a sue happy country. Alternative Balance provides insurance for the coaches, amongst other professions. They also provide insurance for holistic coaches on the human side. And it's really reasonable. It's less than $300 a year. You can add a cybersecurity clause to it, which I think is really important in these days, as we all get hacked on a regular basis. And what I tell the coaches, I modeled this after the human coaching side. So the words diagnose, treat, and prescribe are never coming out of your mouth, and they are never written, because that's not what we're about. We're here to provide lifestyle support and nutritional support and support through various supplementations and other modalities. But we can never, that's where the AVMA and the powers that be will get super unhappy with us.
Right.
And
And it
the
is
other thing
a
that,
law in California that you cannot treat, diagnose, perform surgery, puncture the skin. Like I say that before every single presentation, because
Mhm,
it's in the California law. And so
exactly.
protection. But I had a vet get very agitated with me, being a practitioner going to horses, thinking that I was impersonating a vet, but I never take their temperature. I never do their stats. I'm like, that's up to you guys. That makes me look like a vet, and I don't want to wear an orange jumpsuit. So
Amen.
you guys do that. If I was a horse trainer, I could do that. When I was a horse trainer, I did do that. But walking onto your property, I cannot look like I'm performing veterinarian services.
Exactly. Exactly. So, and that's critical, is to know the bounds you need to stay in to keep yourself out of trouble, and to keep this brand new profession out of trouble as well. Because if we can operate in the space where the veterinary profession feels comfortable, then that adds more legitimacy to us. It helps the profession, the veterinary profession, become comfortable with us and understand that we are there to aid and support them and not take away from them.
And Janice is saying a lot of my work is just basically teaching people how to observe their animals.
Amen. I mean, that's kind of the thing, is that I think a lot of what's happening is that people are so busy with their phones, with the box, with all the stuff we do, we don't take time for ourselves, let alone for our pets, to just sit and be. And I think that if we did more of that, we would see things much faster and be able to support them much more quickly and prevent disasters from happening.
Awareness. The sooner you see it, the sooner you can be proactive. I
Exactly.
I have a ridiculous story that I just put two and two together. Is my dog was a Facebook giveaway. He's always been emotionally shut down to a dog collar, and it just dawned on me that maybe it wasn't just emotional. He always wears kind of thick collars, is a little bulldog, and he has chronic ear infections. I'm like, oh, oh.
Don't you hate it when that happens? It's like, oh,
After
God,
2 years,
how
I
did I
was
not just?
like, that's so I'm like, yes, he was probably emotionally shut down because he's like, get it off, get it off.
Oh, it
Yeah.
hurts, it hurts. And, and I get it. I mean, I'm a vet, and our little dog, Hayo, she came out of this horrible situation. She had one of her legs broken, so she's literally 2 inches shorter on this side for a 6 pound dog. Well, where's going to be the pain that crops up in her neck because she's standing twisted and taking. Well, so when she's painful, she paces in circles, and
Oh,
it's like, oh, damn. And it took me about, sadly, 6 weeks to put that together. And it's like, But yeah, it's just
But we're
observing
human.
and like, why is she doing that instead of being, God damn it, Hayo, stop circling. Like, why is she doing that? And and so Mary Jo and I were like, what is going on with her? And so then we picked her up and I'm palpating deep and she's like, ugh. And I'm like, oh, sorry, honey. So then we started working on relieving the pain and improving the inflammation from the arthritis that she's probably got there.
So in your courses, do you have like a homeopathic track, a herbal track, any of these other like additional elective type things?
That's the goal for part of the goal for the postgraduate association for the International Holistic Pet Health Coaching Association is to provide continuing education. My whole goal with this program is to get people up and running and able to handle about 85 to 90% of what they're coming across. And then as we add more modalities and have more experts come in to teach, then as a student finds like, hey, homeopathy is really clicking with me, then they know who to go work with to learn more.
That's great. That's cool. And so I know a lot of our members have become aromatherapist experts, animal
Right on.
aromatherapist experts. And so now Julie's like, hey, I'm like super excited about this because she can add this to her practice and just have a more whole pet practice.
Right on. Exactly.
What what if you're not into cat? Like I don't work on cats really. I do muscle testing so I can muscle test cats, but I don't feel confident making like cat recommendations. I don't, my cat's a barn cat. Like I'm not super proactive in cat health. Can you like differentiate like a dog track and a cat track, or is it all together?
It's all together, but to be honest, that's kind of what we're finding with this Facebook group is that we need more cat information and like a specific crash course. They're like, please give us a crash course in cats because, and I've got to work on that. But it most of it is geared towards dogs because that's the species that we deal with the most often. But there are some information for kitties in specific. And there are several people in that are graduated coaches that have a lot of experience with cats, which is wonderful because then they can share their knowledge and help you bring that up. And we
Yes.
have canine massage therapists. We don't have anybody, so you guys have awesome questions. We don't have anybody doing acupressure or iridology, but it's just because that's not in their current bailiwick, so to speak. And the restrictions to modalities, supplement, food, et cetera, is as long as you are saying the words recommendation and support and not diagnose, treat, or prescribe, then really is there's nothing out of bounds. And just being out of an abundance of caution, being clear with the pet parent or the person with the horse owner saying, do this slowly so that if there's a problem, you're not like full bore and you've got a couple of days of dealing with the out, the fallout of it, and just start it slowly, incorporate it. If you hit any of this, and this, stop and message me.
Absolutely. That's just pure wisdom. I also always tell my animal owners, if there's anything I do that's uncomfortable, feel free to say stop, you know.
And that's critical too, because most pet owners have been like so slammed by the vet that they get a bad feeling in their gut about something and then they don't act on it and then something happens. So you are the one that's living with that dog, that cat, that horse, and you have an idea, like they're going to give you an idea really quickly, whether you understand what you're receiving or not. Oh, no, 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 no. Or, yeah, this is really a great idea. So I think you should trust your gut to know whether it's a good idea to move forward with that idea or not.
Yeah. Yeah, I do feel like a lot of pet owners have been just railroaded and they don't have a voice, but they do know their pets better than everybody else. So I'm like,
Yeah,
feel free to use your voice. I'm totally open
exactly.
with that. Yeah,
And you're the one that is truly your animal's best ally because you live with them, you know them the best.
absolutely. You guys, any other questions? I can pull up the gallery so everybody can hop on here. Go ahead. If you don't have your camera on, if you want to do that, you might be on your lunch break or at work or something. So any comments? Nothing?
I just feel like I'm seeing the same thing. I was a pediatric nurse for a long time before I became an animal homeopath, and I'm seeing the same thing in veterinary medicine that I'm seeing in physicians, is that they are not taught the basics of care. They are taught medicines, and that's it. And so if they don't have a medicine to apply to you, then they can't have a conversation with you. And it's something as simple as, I had somebody come in with a dog with Bell's palsy, and the vet gave them steroids, but that dog was so uncomfortable because they didn't learn how to take care of the weepy eye and how to take care of the drool and all that stuff. Those are so important to keep the dog comfortable, and they just ignore it. And I have so many people coming to me with just little things like that, just the little practicalities of how do I actually take care of my dog, not just give drugs.
Exactly. The nursing care. I mean, and that's what, I'm 60, so I finished veterinary school in 1990, but that was part of my education. And now it's not. Now these kids are learning flowcharts, and that's exactly where they
Yep.
live. And
Yep.
Janice, to your point, this is that at that year, that is where veterinary medicine was more advanced than pediatric medicine. I mean, they were doing open heart surgery on children with basically paralytic agents, no pain control whatsoever, not understanding why there was a 50% mortality rate. And it's like, holy crap.
Yeah. Yeah.
Oh my God.
It's like, oh, I mean, but, and, anyway, that's a whole nother discussion, but you're exactly right. The nursing care and what to do. Like if you have a dog with a neurologic problem and it can't empty its bladder, that's one of the things that kills those dogs.
Yeah.
Because they get these gnarly urinary tract infections. So that's another thing a coach can help you with.
And the other thing that really bothers me is knowing the drugs that I used for decades in the position I was in. The drugs that are being complained about the most by people using them are the drugs that are now being introduced into veterinary medicine. And it's making me very sick to my stomach. And I try to explain to people, I remember giving this drug to people. They complained all the time.
Yeah.
And this is what they complained about. And they look at their dog and go, oh my God, it's so true.
And that's it. And they just rename them. And it's like, whatever didn't work in human medicine, they dump on us. And sadly, my colleagues are not willing to do research beyond what the drug rep says. But I mean, Proin, one of the most widely prescribed drugs for urinary incontinence, was pulled off of the human market because it created neurologic problems and seizures.
Oh my gosh. I know so many dogs on Proin, and the owners are so scared to take their dogs off of it. I'm like, there's so many other ways, but I can't advise on that. I'll be like, just do your research.
And so many people on gabapentin started having rage attacks. And now we're wondering why these dogs are having rage attacks, when all they started out with was pain.
Right on. And the dosage, like, I mean, I've used gabapentin in the past, but like a third or a quarter of what the way most veterinarians will prescribe it. And it's just like these dogs are just comatose. It's absurd. I mean, that's no quality of life.
Yeah.
And then all the other stuff. So right on.
Yeah, and post-surgery. So lots of my clients will call me and say, they want me to go through surgery. I'm like, you need to ask the aftercare, because they don't tell you that stuff. Surgeons love to cut. They don't do the aftercare thing. And yes, I got totally messed up with the paralyzed dog with bladder expressions. Its bladder never came back after a surgery, and it was a big deal. And so now I coach everybody, always ask about aftercare, what that's going to look like. And often my clients just euthanize at that point because they're like, oh, we had no idea.
Yeah. I mean, when they do IVD knee surgeries, it's like, and your dog is already down. I mean, at that point, honestly, from what I've seen, I'd rather do uh, conservative therapy. So with all the other tools we have available, laser, acupuncture, whatever, and see what we get rather than put that dog through that brutal surgery and nothing ever changes.
Yeah. I mean, you have time. Why not try it?
Exactly. And and then you have a chance of preserving your dog's quality of life and really understanding what's going on and how life might be for that dog long term.
Exactly. Charlene just said her dog died due to Proen.
Yeah, I don't
I
doubt it.
didn't know that, Charlene. I'm so sorry.
It's yeah, it's not a fun drug. And I mean, honestly, if my colleagues were more into prescribing estrogen, that would do so much better. Synthetic, yeah, it is, but it fixes the incontinence and then it also shuts off the luteinizing hormone production.
Could you just do like flaxseed?
Not really, because I think if you're going to go after more of an estrogen support, that's where all of the other things like maca or sweet potato or yams rather
Mm.
would be a better option. I think flaxseed, the lignans can be helpful, but because there are so many dogs with food sensitivities to them, it just is not worth it in many cases. But I mean, for Cushing's dogs, that's where lignans, so flax seeds, and uh, my brain is blanking on words today. Crikey, the nighttime stuff to help you sleep. Sorry.
Melatonin.
Thank
Melatonin.
you. Yeah, I mean that can make a massive difference for these dogs because what we're doing is helping to re-regulate the hormone balance in that situation.
Oh, that's such wisdom. Oh, I never used melatonin on a Cushing's dog or in a horse, but
It can really be helpful, and then combine that with really supporting the liver so that the liver can help clear the excess hormones and improve the gut function to help, so it's not just one thing. It's tying it all together to make that system function more normally.
it's holistic, the
Yeah,
whole health. It's not,
the whole
and medicine being system, go to your cardiologist, go to your pulmonary specialist, go to your dermatologist, and nobody's comparing notes. It's so frustrating.
it's incredibly frustrating.
Yeah, I like to say the body is a Rubik's cube, and when one thing's out, the whole puzzle's off.
Exactly. Yeah, and you got to work with everything together.
Any other questions, you guys? I am sure Dr. Ruth needs to get on her busy day. Nothing else? No more? Okay. Dr. Ruth,
Thank
thank
you all.
you so much. And I did drop the link in the live feed. So if you guys want to grab that link and check it out and start a career in pet health coaching, go for it. We're here to
And
support you.
and definitely tell us Poppy sent you because we want to support our supporters. Poppy, I cannot tell you how grateful I am for bringing me on to talk about what we're doing to help educate people about the other helps they can offer pet pet parents, pet owners. So thank you for all that you and your compadres are doing in this world.
We are grateful. It is a collaborative community, and we just support people like you.
Amen. Thank you.
Take care, you guys. Have a great week. Bye, you guys.
Bye.